Hi everyone, my name is Mededovic and I'm a PhD student in Dr. David Kohn's lab at the University of Michigan. Today, I will talk about my research where we are approaching bone fractures from a completely new perspective. You or somebody you know probably has broken a bone in their life, and that's actually really common. 6.8 million people a year in the US break their bone. However, 5% a year, or 350,000 of those broken bones, don't heal and they get a diagnosis called non-union. You know, the healing process is actually really complex. We think of bone as just this hard material in the body, but there's actually cells inside, nerves, and a lot of blood vessels. So when you break a bone, the first thing that happens is that blood vessel breaks and the blood pools. This recruits a bunch of cells, including immune cells and stem cells, which slowly build a soft scaffold, and then they start to add mineral to the bone. Eventually, the bone fully remodels with scaffold, mineral, and blood vessels. Because there are so many steps in this process, if there is a lag or failure in any of these steps, one can get diagnosed with non-union, which means the bone simply stopped healing. This often happens if the bone isn't stabilized, like imagine building a new road during an earthquake, or the blood vessel just didn't develop enough to feed all the cells that are there to help heal the bone. If somebody has diabetes or a more complicated fracture, they're at higher risk of this complication. We're lucky that scientists have developed some tools to help those with non-union. They can go back in and add internal fixation or a graft from another bone in the body. There's also a less invasive process, a bone stimulator, but we have very limited evidence that this works, and it's a hassle. Patients need to use it for hours every day. So graft and screws require complicated surgeries, and the patient has to go through the healing process all over again. And bone stimulation actually just technically helps cells create more mineral, but we already know that that's not all that happens during bone healing. Since non-union is pretty common, we need to help develop a more successful approach that will consider the whole bone healing process and that is less invasive than current best practices. Since most of non-union happens because the blood vessels don't grow enough, we need to tackle that aspect as well. What I'm working on right now is to create a gel that has particles that code cells to make them more, let me say, chatty. Since there's so many cells coming into the fracture to help heal the bone, I designed it to only release the code as the two key cells come in contact with it. It's a mouthful, it's complicated, so let me explain. We understood that healing bone is actually a really big job, and cells need to coordinate to get the job done right. To do this, they need to communicate with each other, and there's a couple of ways that cells do that. One of them is paracrine communication, where cells excrete chemicals that target one another, like texting. And another one is short distance, where cells share chemicals really easily and quickly, like talking in person. And if you're doing that during a pandemic, you should definitely be wearing a mask. So if the cells are trying to make a huge plan, they will probably need to make some texts, but the best and most efficient way would be for them to talk it out in person. We think helping cells communicate better and faster will help heal bone. We found out that this short distance communication, gap junctions, are really important in bone. They help bone cells sense force, and they help stem cells differentiate or choose what kind of cell they want to be in the future. So if we know that chatty cells work well together, we want to make those cells even more chatty and better organized, which is what we will do with these coating particles inside the gel. And another aspect of bone healing isn't just how well they communicate, but who they communicate with. We need a diverse team to help finish this complicated job. There are so many blood vessels in the bone, and blood vessels and bone cells actually really work well together. They communicate mostly through short distance communication, and this helps stem cells differentiate and grow, but they also help make stronger blood vessels. These are the two key cells that we want to target in my research. So the overall goal is to get this gel at the fracture site, which would code stem cells and blood vessel cells to be more chatty with each other, which would help them coordinate the huge job of healing a bone faster and more efficiently. We expect and hope that this therapy would help the body heal bone that originally didn't want to heal, so that those who struggled with non-union, were in a lot of pain, or were immobile, can regain a normal life. Thank you.